Hi, I'm Rachel. I'm a C2 member of the Portola Valley Pony Club and Portola Valley Pony Club Junior Board. In this video, we're going to be reviewing all the information you'll need to pass your C2 rating for Conformation and Lameness section. So the first question in the Conformation and Lameness section of the C2 rating is, name the 5 basic conformation qualities that you want in a mount for your own use and how they affect the basic movement and soundness. So some examples that I would use would be that the horse is uphill, meaning that the withers are above the haunches, and that allows them to move uphill with impulsion from behind and less weight on the front legs, rather than a horse who's downhill, meaning the haunches are above the withers, which would cause the horse to be on the forehand all the time and have trouble moving its back feet underneath itself. So that's important for dressage and jumping, where you need a lot of impulsion and action from the hind end. Another thing I would do is I would look at the back of the horse. If a horse has too long of a back, that means that the top line of the horse is either similar size to, equal to, or longer than the underside of the horse, which means the horse will have a harder time bringing its hind legs underneath itself because it has to bring them further since the back is so long. It also can make the back can be weak sometimes if it's too long and cause issues with soundness later on. So basically what you want is you want the underside of the horse to be significantly longer than the top line of the horse to ensure that it doesn't have too long of a back, but obviously you also don't want a short back, which is the opposite. A strong, good length back without mutton withers or high withers, which can cause saddle fitting issues and can also cause soundness issues. So also I would look at the pasterns of the horse. The ideal angle of pastern is 45 degrees to ensure that there's the most cushion and that the hoofs are hitting the ground at the correct angle to spread out weight evenly and prevent concussion damage. If it's steeper than 45-degree angles, that's the best way to get concussion damage on your horse. And then if it's shallower, there might not be enough cushioning. The pastern is probably weak from that. Same if it's too short, then there's not enough cushion. Also, the angle of the pastern and the hoof should align, so they should have the same angle. This can be fixed with shoeing if it's off, so it's not too big of an issue. Also, straight hoofs and legs are important because they affect the way the horse moves. So especially if you're in dressage, that could be important. So if a horse's toes are in, that means they're kind of faced like this, and if they're out, they're faced like that. So the hoof is actually rotated like that. So if they're in, they can actually cause them to paddle like this, so their legs go out to the sides. If they're out, it can cause them to wing in, meaning they trot like this, so they cross over their feet in the front. So also, another conformation quality you might want is a nicely proportioned and length of neck on your horse. So ideally the neck and head should constitute a third of the length of the horse, and the top line of the horse's neck should be longer than the underside of the neck, as shown in this picture. If the bottom of the neck is longer than the top line, that's called an ewe neck, and that makes it basically impossible for the horse to actually come around or stretch over its top line. Short-necked or bull-necked, that also, it makes it harder for them to stretch and flex their neck. So when you're assessing a horse, you would look for a horse with a neck about the third of the length and the top line slightly longer than the underside of the neck. Also something that's sometimes overlooked or less important, heart room of a horse. It's believed that if a horse has a bigger barrel, a bigger chest, it means that the heart has more room, and it could mean that the heart is bigger. Allow the horse to have more stamina, like for a racehorse or for an eventing horse doing cross country. Also, a really good quality is to have good shoulder and hip angles, which we're going to talk about next. So the next question is to discuss the angles of the shoulder and hip of your horse. So obviously I don't know what your horse looks like, but I can give you a little bit of overview of how to assess shoulder and hip angles on a horse. So the shoulder angle, if you look at it this way, you'll see the line they drew should be about 40 degrees to the ground. A more accurate way to measure it is to take from the scapula, which is the bone right about here, down to the point of their shoulder and then back to their elbow. So this angle here should be about 90 degrees. which as you can see is about 90 degrees on him. If a horse's shoulder is more than 45 degrees, meaning that it's a steeper angle, then the horse will have shorter strides. And if the angle is less than 45 degrees, then the horse will have longer strides and have a more open shoulder. So basically the hip angles. The hip should have
equilateral triangle
that the
when you
are
connect these 3
proportioned well.
points shown
Additionally, the slope of the pelvis, which is the top line of the triangle, should be about 30 degrees when you're measuring it to the ground. So the 30 degrees is the ideal angle, but for some horses like draft horses, they have a more sloped pelvis to help them pull things because they can get power from their hind end more easily. So other horses like thoroughbreds, like racing horses, they're the opposite of draft horses. So they have a less sloped pelvis angle, which means they can have bigger strides and go faster rather than pull a lot of weight. So if you have horses like draft horse or thoroughbred, then you can assess that and explain that to your examiner. Another important angle in the hips is this angle that highlighted right here. That angle should be about 90 degrees. If it's more than 90 degrees, then if it's more than 90 degrees, which is really common in thoroughbreds and racehorses, they can have more reach and have a bigger stride so they can go faster. And draft horses tend to have a more closed angle, which means they have more torque, like if you know what that is. Means they can pull more, get more power and pull carts and stuff, but not necessarily have a big stride and go forward, and go fast. So next, you will be asked to describe the difference between Tobiano and Overo, and Dun and Buckskin, and Gray and Cremello. And these are all colors of horses. Overo and Tobiano are colors that look similar to a pinto or mostly a solid color. With the differences are normally than Tobiano's. Their legs are dark, their mane and tail don't have any white in them, and the white never crosses over their spine. In Tobiano's, the white most of the time crosses over the spine of the horse. Also in Tobiano's, the mane and tail can have white in it. The legs are normally mostly white. Often there's more white than dark on Tobiano's compared to Overo's, but it's not all the time. So next is dun versus buckskin. I'm sure you guys know what a dun and buckskin look like. The main difference is that the buckskin does not have a dorsal stripe and the dun does. So if you don't know what a dorsal stripe is, it's a darker or black marking that runs across their spine. A good way to remember this is buckskin, like buck deer. Deer don't have dorsal stripes, so you can think of it that way. Buckskins don't have dorsal stripes, and duns do. But other than that, they are pretty much the same, cream-colored coat, black legs. The next one is Cremello and Grays, and the biggest differences between these two colors are the color of the skin and eyes, and the fact that Grays are born black and they lighten over time until they're basically white, while Cremellos are born white. Cremellos have pink skin and blue eyes. Also, Cremellos can't have any dark areas on them. They're completely solid white, while Grays can have dapples, or when they're older have lots of dark on them. Grays have black skin and brown eyes. Also, for your C2 rating, you're going to need to be able to name parts of the mouth and the types of teeth in a horse's mouth. So parts of the mouth you'll need to know are the lips, which should be obvious. The bar of the horse's mouth is the space between the incisors and the molar where the bit goes. So the types of teeth are incisors, premolars, molars, wolf teeth, and canines. The incisors are the front teeth. They have 6 on the top and 6 on the bottom. The central, intermediate, and corner incisors. And then the premolars are in front of the molars in the back, they're after the bar. There's 3 of them on the top and bottom on both sides, so that's 12 premolars because there's 3 on each side on each jaw. And then there's also 3 molars, so there's 12 more of those. And then the wolf teeth are in front of the premolars. They only occur in very few horses, almost no mares. It's very rare to find a mare with wolf teeth, but it has happened. And some geldings have wolf teeth. And canines, about 28% of mares have canines, and most geldings have canines, which is right in back of the corner incisors. So the last question you're going to be asked is to discuss the conformation of your own horse and how it relates to his breed or her breed. We kind of talked about the differences between conformation and breeds in the hip and shoulder angle section, so you could use that information. You could also, if your horse is like a draft horse, you could talk about like a bull neck, or basically what I would do is research your horse's breed and what the conformation is for, and like what the conformation is, how it's different from other breeds, and if that's the case with your horse.
This is Zin, and I'm going to show you how to name and locate common unsoundnesses you need to know for your C2. This includes ring bone, side bone, navicular, bog spavin, bone spavin, curb, thoroughpin, bowed tendon, splints, and sprains.
So ring bone is caused by arthritis in either the pastern or the coffin joint, which is down here in their hoof. High ring bone is in the pastern, and you'll see it because there'll be a hard lump right in front of the pastern here. And low ring bone, you won't be able to see, but you'll be able to tell because your horse will be lame. High ring bone most likely means the horse will be lame for the rest of their life, while low ring bone is possible to cure but difficult if the joint is able to fuse.
So bowed tendons can be in front or back legs. They will be in the tendon part of the leg. Sometimes you'll be able to see them because the tendon will bow out, like you'll see it'll be curved. It's caused by an increase of work too fast or over exertion of the horse. They will recover from it, but they'll never be as strong on that leg as they were without it.
So side bone is arthritis in the heel bulbs, which are back here. It's usually caused by large feet or upright pasterns, and there's not very much treatment for it.
It is down in the heels, and it is any damage to the navicular bursa or navicular bone.
It's likely to cause lameness for the rest of their life and can be diagnosed with an MRI.
And a curb is a swelling right here, the lower part of the hock. It will cause mild lameness.
You can sometimes tell a horse has had a curb before because they'll have white marks on the back of their hocks right here. So a bone spavin is a hard, bony swelling in the inside of their hocks. It's caused to arthritis in the lower hock joints, and it's usually around here. So sprains are basically damage to any ligament. A ligament is what connects bone to bone, so it's in every joint on the horse. You can tell that they have a sprain because they'll be swelling in the general area and they'll be lame on it. So a splint is basically ossification in between the splint bone and the cannon bone, and so it'll appear right here, or on the more commonly on the inside of their front or back legs. And you can tell because there'll be a hard lump there, and it'll usually cause lameness. It's normally caused because of too much work or workload increasing too quickly. A thoroughpin is swelling right here in the hock joint. It normally doesn't cause lameness, but it can sometimes damage other things around it. It also is caused by excessive work.